Sustainable healthcare is healthcare that meets the needs of current generations without compromising the needs of future generations or the social and natural systems on which our health depends.
So the work we do on climate change and healthcare policy has focused really on sustainable healthcare systems. In other words, how can we make our hospitals and health services greener and use less carbon? People from governments and philanthropic organisations and industry come to the Evidence Review Service to gather knowledge to address challenges that they're facing.
We need to embed different practices to ensure that we are well geared not only to reduce current footprint, but also that we leave the world the best to our future generations.
A lot of what we actually can do within our work at Behaviour Works is work with hospitals or the healthcare sector in general to try and look at attitudes and things and how we can actually understand why people are doing what they're doing to then really target those particular behaviours.
We know that about 80% of the emissions that come from healthcare come from the decisions that healthcare professionals make day in, day out when they're delivering their care. So we need to take a systematic approach. As an example, we can look at our buildings, make sure that they run on renewable energy or become much more energy efficient. We can also think about the things that we buy for healthcare. So the drugs, the medical devices, the food, and look at how we can reduce the amount of carbon coming from those and the way we dispose of them.
The link between climate and health is actually relatively new. So what we're needing to do is to gear up people for maybe new expectations, practices, and new learnings that they can apply from day to day within their work.
We did a large review for the Royal Australasian College of Physicians and 10 other colleges in Australia a few years ago that really laid out the groundwork for how we can do better on making our hospitals and health services greener.
A circular economy is an economy that doesn't just follow a linear process of make, use, chuck away. What a circular economy does is really be intentional about resource use and look at ways to reduce, repair, recycle. People are using cloth gowns instead of plastic gowns so that they're able to reuse them rather than just throw them away.
We think that people know exactly what to do, that they know where they can make differences, and people need some support and some new knowledge to do so. We can be very successful in one part of the job, but it doesn't mean that we understand what we need to do to become successful in another area.
We can think about the way we deliver care. We know that a certain amount of care that happens in health systems is not always as high value or as safe as it could be. We also know that carbon emissions come from hospitals where the most intensive care is. And if we can keep people healthy for longer and get care closer to home, that will also give us better outcomes for patients. It'll give us better financial savings and it will also reduce carbon emissions. So it's a triple win.